All right. So, welcome to the foot. There are a lot of bones down here, as you guys know. We're going to start with the top of the foot because it's kind of maybe easier to start with. So, I've got a lot of drawings here. Let me unhide or hide this one and then bring up the dorsal aspect of the foot. All right. So, this is the top of the foot. It may not be apparent to know that right away, but the biggest hint is that we're seeing the hyaline cartilage of talus pointing right up at us. And that's where we're going to form that talocrural joint. We're going to dorsiflex and flex or plantar flex the ankle. The subtalar joint, which is underneath that, is where we're going to be able to invert and evert. And hopefully we'll show some better views of that later. But this is the top of the foot. So let's break down what we're looking at. All right, so we're going to just start by naming each one of these bones. And we already said that this one was talus. And this is actually its articular surface. And it's forming that talocrural joint. Now we're moving distally. We're going to have navicular. Now, navicular is going to articulate distally with the three cuneiforms. I kind of think of navicular in a team with the cuneiforms. So you kind of have this base of navicular down here, and then right above it you have the medial, the intermediate, and the lateral cuneiform. So kind of think of these all together. And let's go through those cuneiforms. So we've got three of them. This one is the most medial, so we're going to call it the medial cuneiform. This one here is the intermediate. And lastly, we've got lateral, because we're going toward the fifth digit, the pinky toe, so we are moving laterally. It's appropriate to call this the lateral cuneiform. And we can see the cuneiforms kind of have this, again, a nice arrangement. Try to get your brain to organize how these are all articulating with each other, because I think it makes a lot more sense than just memorizing. But you can see the medial cuneiform is going right to the first metatarsal. The intermediate cuneiform is going right to the second metatarsal. And lastly, the lateral cuneiform is going right to that third metatarsal. Okay, no one's in the waiting room. Good. Thought I saw someone in there. But like you can see, the cuneiforms are all going to that first, second, and third metatarsal. So that's a nice relationship. Now, what articulates with the fourth and fifth metatarsal? Cuboid. Again, another relationship. So here's cuboid. Now, cuboid is going to articulate with the fourth and the fifth metatarsal. So backing up a little bit, we saw talus down here in the bottom left, forming the very top superior bone of the foot. Navicular is moving distally from that talus. And then with the navicular, we have the three cuneiforms, the medial, the intermediate, and the lateral. And those are all going to the first, second, and third metatarsal. So let's label that. These are our metatarsals. We have them in the hands too, but we call them the metacarpals. These are the metatarsals because we're in the foot. Now we've got 5 of them. 1, 2, I actually want to put that here. 3, 4, and 5. Now, each of these has really 3 prominent anatomical locations that you should be aware of. We have a head, we have a shaft, Or I think it's called the body. I think it's body. No, 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 it's shaft and then body is below. That's right. And these three portions are you want to be thinking about, and it's going to repeat with the phalanges as well. We have a body, we have a shaft, and we have a head. And these, well, we'll kind of back up and show all of them as the phalanges. And the phalanges, we normally have 3 of them. The big toe only has 2. And we name them based on their anatomical location. So you have a proximal, you have a distal, and you usually have a middle in between, because like I said, most of the toes have 3 phalanges except the big toe, which only has a distal. Actually, want to put that inside maybe. And a proximal. And the rest, we have proximal, middle, and distal. Same with the rest. Now, our last bone down here is calcaneus, your heel bone. And these are the bones of the bottom of your foot. So again, we have talus, which is forming the most superior bone, where we're forming the talocrural joint. Let's put that there. And the movements at the talocrural joint, that's going to be plantar flexion and dorsiflex, moving in that sagittal plane. And we'll see the subtalar joint in a little bit. But these are the bones. I'm going to pause the recording. Okay. So that's not what we want. This is what we want. So now we are on the bottom surface of the foot. We're not seeing that prominent talus looking up at us, but we are seeing its distal articular surface, which is again that hyaline cartilage portion. So this right here is talus. Oops. Not just right on it. So this is talus. And it is its distal articular surface. This is where it's going to be articulating with navicular, and I believe another bone. It's a little tricky, but mostly navicular, as we can see just through this image. But that's talus. A little weird to wrap your head around that, I know at first, but just give it a second and this will start to make more sense, especially as we start to draw more and see other angles. And this huge bone, this is your heel bone, and this is the underside of it, and we really get a good idea of how big this bone is by looking at its plantar surface. So here is calcaneus. We have a few prominent landmarks on calcaneus that we're going to talk about. We have this region up here, which is kind of a little bump right there that we're going to call the calcaneal tubercle. Very important muscle origination and insertion point. We also have the calcaneal tuberosity back here. And we have something that's going to sustain the talus. Maybe something coming to mind. Sustentaculum tale. So we're going to sustain the tale with this bony prominence on calcaneus, because we can see talus is right above it. Makes sense. So that is all calcaneus. Let's move a little more distally. And now we're seeing the underside of cuboid. How do we know that? Well, we know that cuboid articulates with the 5th and the 4th metatarsal. So look for the phalanges and go inward from there when you're first trying to figure out what all these bones are. Now we have a prominence on cuboid known as the tuberosity of cuboid. So tuberosity. And I kind of drew over another important landmark, which is on the 5th metatarsal. This is the tuberosity of the 5th. Metatarsal. Very palpable, kind of hides that tuberosity of cuboid. You really feel the tuberosity of the 5th metatarsal. If you run your hand down the lateral surface of your foot, you'll feel that bump. And that's an important insertion point for muscles, or just one muscle like fibularis brevis. But we'll get into that when we show all the tendons. Now, over here, we've got that bone that forms the foundation for the cuneiforms, because we see those 3 cuneiforms above. Now, what is it that's going to support it? Well, that's navicular. I think Dr. Love says something about a boat with navicular, but I can't remember what it is. So hopefully that's helping you with navicular. There's some type of boat thing.
It means boat-like in Latin.
Okay, and it has kind of a boat look to it.
Yeah, we could imagine that, right?
Seriously though, I'm having a hard time seeing the boat, but hey, maybe some people see the boat. I just kind of remember it as, oh, it's the cuneiform base. So there's medial. We know up next must be intermediate. And then lastly is lateral. And again, the medial cuneiform is going to articulate with the 1st metatarsal. The intermediate cuneiform is going to articulate with the 2nd metatarsal. And the lateral cuneiform is going to articulate with the 3rd metatarsal. All right. Now let's again show those metatarsals. You remember they have a body, a shaft, and a head. We can kind of see the dilation for the body and the head, and then the narrowing for that shaft. These are the phalanges. And again, we normally have a proximal, a middle, and a distal. Now let's think about some of these joints, because we've had a lot of articular surfaces down here. And especially with these metatarsals and phalanges, there's a lot of different joint names that can be confusing, but it doesn't have to be. This joint right here is part of 2 of them, usually, but with the big toe, we only have 1. It's between the phalanges, and we're going to call it an interphalangeal joint. Now, to compare that with the other phalanges, which have 3 phalangeal bones, they have to designate which one is proximal and which one is distal. So if this one and this one are the IP, interphalangeal joints, this one is proximal. So we're going to call it the proximal interphalangeal joint. And this one is distal. So we're going to call it the distal interphalangeal joint. Pip and dip. How nice. So pip and dip. Dip and pip. And again, dip and pip. All right, that just got like 9 joints. We're on a roll, guys. Let's keep going. This one here is a metatarsal. This one here is a phalangeal bone. So we're going to call it a metatarsal phalangeal joint. One thing you're going to love about the foot is it just makes sense. But when you put like DIP, PIP, IP on a piece of paper, it's just super confusing. It's like, I don't know what you're talking about. But if you just say it out loud, distal interphalangeal, okay, I got that. And again, this is a metatarsal phalangeal, MTP, metatarsal phalangeal, MTP, MTP, MTP. All right. Now we do have some articular surfaces down here, but we don't really move at them that well. So we're not really going to be designating these as any significant joint names we need to remember. However, the metatarsal phalangeal, the proximal interphalangeal, and the distal interphalangeal are definitely important ones that you want to keep in mind. And also, the subtalar joint is in view, kind of. We see talus, and we know this is the plantar surface of the foot. So we know that we must be looking at the subtalar joint here. So we're seeing kind of a little view of the subtalar joint, which is really important to differentiate from what we discussed before, which was the talocrural. Talocrural says talus to the crura, which is the leg or the tibia, really, mostly. So that is the talus to the tibia. This one here is the bottom of the talus to the calcaneus below. So we're going to call it beneath the talus, the subtalar joint. And here is where we're going to be able to create eversion and inversion. And I'll go ahead and pause the recording. So we're back to the bottom of the foot, and we're going to draw in some really important ligaments that we want to be aware of. So first of all, we have tendons and ligaments down here, and those are two very different things. Tendons are coming from muscles that are going to bone. Ligaments are bones going to bones for stabilization, usually of a joint. So let's look into the ligaments first, and then we'll draw a lot of the tendons that we see coming from the leg compartments down here. I'm gonna make this a little opaque. So first of all, we've got these things called collateral ligaments, and these are around the dips and the pips. Kind of like this. Oops, let's unhide that layer. We've got these collateral ligaments. There are a lot of collateral ligaments. I wish I didn't have to draw them, but I will draw them because Dr. Love wants you to be able to distinguish these from another ligament around here, which is the plantar ligament. Now, the plantar ligament is kind of here instead. Let me actually label that first before I move on. These are collateral ligaments. And notice they're kind of forming the sides of the joints. So the collateral ligaments, they're around this larger sheath, which I'm about to draw, but they're forming the lateral sides. Let's show you that sheath. There's a sheath here, which I probably could have drawn first, but I wanted to talk about collateral and plantar ligament first. But these are both surrounding the joint capsule of the pips and the dips. We have a collateral ligament, again, these. And then we have a plantar ligament, which is running on the plantar surface. Plantar. And then over here on the big toe. We have collateral ligaments on the sides. And then we have a plantar ligament down the center. So these plantar ligaments are kind of just a nice depression so that we can have flexor tendons running through here. Because this is the bottom of the foot, we have a lot of tendons coming from different flexor muscles like flexor hallucis longus comes through here. And where's it got to go? Through the plantar ligament. And then it will find its way at the distal phalanx of the big toe. But I'll erase that because we're not going there just yet. But do be aware of these capsules. And they also exist on the MTPs as well. So that's how the flexor tendons are able to get where they need to be. We have collateral ligaments on the sides, which is kind of stabilizing the lateral joint capsules, just like the tibial collateral and the fibular collateral ligament. And the legs are on the sides of the knee in that joint capsule. These collateral ligaments, same thing. So again, collateral on the sides. We have a joint capsule. I'm going to put that on the side actually because I'm about to draw a plantar ligament there. And then plantar ligament, plantar ligament, plantar ligament, all through here. And we'll just label those. All right. So now let's move a little bit more proximally. So we're going to be looking on the deep surface of this plantar surface near the calcaneus. These are some of the really deep tendons that we, or ligaments that we have down here, not tendons. This is way too deep for any tendons. So we've got one that we're going to be calling the plantar calcaneal cuboid ligament. And we also have a plantar calcaneal navicular ligament. So these names are really nice. Again, there's that calcaneal tubercle, not a tuberosity, it's a tubercle. And this is where we're going to have one very important ligament start. It's starting at the calcaneus and it's ending at the cuboid. So we're going to call this plantar, because we have one on the dorsal surface, calcaneo cuboid ligament. And then over here, we have another one, which is kind of coming off this sustentacular tali and going over to navicular. Too dark. Let's do this. Nice. Crossing right over talus. And again, the names are really nice here. We're starting on calcaneus and ending on navicular. Think about what you would call that in your head. It's the plantar calcaneonavicular ligament. Now, they also call calcaneal cuboid ligament the short plantar ligament, if you want to put that on the side. Dr. Love is going to use the nice terminology. She's going to be using the calcaneal cuboid ligament or calcaneonavicular ligament. So she's telling you where they go. That way, if she asks you any questions like injury-wise or where they are in relation to other structures, if you can kind of maybe draw the foot and all the bones and then just draw a quick sketch from what bone you're going to the other bone in that ligament's name, it'll give you a much easier understanding. You don't even really have to memorize all of these ligaments, just as long as you know that we do have a ton of ligaments down here. The calcaneus, the cuboid, and the navicular are huge bones. Of course, they're going to have ligaments going to one another. They're right next to each other, and they're in the foot, and we put so much weight on our feet. I can go over so many more ligaments. I don't know how many ligaments there are. Luckily, we're not going to touch on every single one of them, just the main ones. But suffices to say, there are a lot, and they're usually named by the bone to the bone that they're going to and from. So now let's add a little bit more layers to this. So this is the short plantar ligament. If we're calling it the short plantar ligament, there must be a long plantar ligament, and that is true. It's coming from here. And it's long, so it's going to spread forward in this long, narrow kind of ligamentous look. It's going to attach to the fifth metatarsal, fourth, the third, and the second metatarsal. So here we've got the long plantar ligament. All right. So this is not to be confused with the plantar aponeurosis, which is an aponeurosis, which is kind of like a ligament, tendon kind of attachment, a little more different than this long plantar ligament. And we're going to show that plantar aponeurosis in just a second. But let me make
That would be really superficial, wouldn't it?
very much
In comparison.
Yeah, exactly. We would feel that really being the most superficial structure in this entire foot. Unless you're thinking skin, which is truly the most superficial structure on that plantar surface. But yeah, very superficial.
Excuse me, sorry. Were you saying the long plantar ligament or the aponeurosis are the most superficial?
The aponeurosis.
Aponeurosis. Okay, thank you.
Yeah, of course. So these are the main ligaments that you want to be aware of in the bottom of the foot. We've got those plantar ligaments in the MTP, IP, and dip joints. Again, that's just forming a nice place for our flexor tendons to orient themselves as they go all the way to that distal phalange or the middle phalange in the case of our brevis flexors. And then joint capsules, you're going to have a joint capsule pretty much in all synovial joints, right? That's not to be a surprise, but do know what's in relation to these joint capsules. We've got those collateral ligaments on the side, and we've got that the plantar ligament on the plantar surface. All right, let me stop the recording really quick. All right, so that's it for the ligaments on the plantar surface of the foot. We're going to see a few more prominent retinaculum on the dorsum of the foot once we get there, and that'll kind of be last. What I want to start doing now is painting over this image we have here. Now, this is definitely not complete. Again, there are so many ligaments in the foot. There's so many, and I can't draw them all. We're just going to think about the most important ones for this class, which we've talked about already. But suffice it to say, way more ligaments down here than just this. But let's start to get into our muscles. So we have 4 layers of muscles on the plantar surface of our feet. Let's start with the most superficial and work our way in. So the first muscle layer, this is going to be right deep to plantar aponeurosis. In fact, one of these muscles in this layer is really firmly adhered to plantar aponeurosis. Maybe in your dissections yesterday, you experienced that having to tear away the plantar aponeurosis from flexor digitorum brevis. Let's draw that in here. So we've got flexor digitorum brevis. We remember flexor digitorum longus, which originated in the posterior compartment of the leg. We have a brevis version of that, which is going to begin on the foot. So it's going to originate on the calcaneus, and it's going to insert on the plantar surface of the middle phalanges of digits 2 through 5. So we're going to start here. And we're going to end the plantar surface of the middle phalange of digits 2 through 5. So we're just going to draw all of those long arms coming out and splitting. And it's truly following the look of the plantar aponeurosis, which would just be right on top of here. Or I should say, right below it. Anatomically speaking, superficial to it. Hope I didn't just confuse you there. Just kind of get some contour to flexor digitorum brevis, and I think that's good. So flexor digitorum brevis. Trying to find a good balance here. There we go. Now this one we said originated on the, we'll just say the calcaneus. And it's going to insert on the middle phalange of digits 2 through 5. And we can put plantar surface there. That's a little redundant because it's a flexor, so we know we are on the plantar surface. Now, we want to think about its innervation. So we'll take a 10-minute break in about 5 minutes once I finish this, these muscles. But so flexor digitorum brevis originated on calcaneus, went to the middle phalanges of 2 through 5. It's innervated. It's innervated by the medial plantar nerve. And this is an important thing you want to take note of because only 4 muscles in this entire foot are innervated by the medial plantar nerve. We'll talk about them. 2 of them are here on this superficial layer. I'll draw the other one right here. This one is the abductor of the big toe. It's very massageable, easily palpable. And it goes to the base of the proximal phalange. So this is abductor hallucis. Its name says it all. It's abducting, so moving away from the anatomical midline, hallucis, which is the big toe. And it's going, again, let's draw those origination and insertions, originating on the calcaneus and inserting on the base of proximal phalange or phalanx of toe 1. Big toe, toe 1, first toe, hallucis, whatever you want to call it. But it's the base of its proximal phalanx. Innervation, like we said before, only 4 muscles in this entire foot are innervated by the medial plantar nerve, and this is the second. So we already got half of them. But there is one more muscle in this superficial layer of the foot that is going to help digiti minimi do the same action as hallucis. You'll notice in the foot, hallucis and digiti minimi have this kind of symmetrical relationship where a lot of the muscles that we see that are in the foot that are supposed to be like a brevis for hallucis also have kind of a version that are a brevis for digiti minimi or the pinky toe. And their originations, their insertions, they're really similar. And as we'll see with this, its insertion is the same place, which is the base of the proximal phalanx, except in this case of digiti minimi. So this is abductor digiti minimi. It's originating on the calcaneus. It's inserting on the base of proximal phalanx of the 5th digit. And, you know, I don't want to be too short because we do want to say, well, if it's abducting, this must be the lateral surface of the base of the proximal phalange of the 5th toe. Gosh, what a mouthful. But it is important, especially when you're kind of visualizing where exactly this muscle is going. It's not coming here. It's on the lateral surface. So do be aware of that. But again, it can be redundant once you know the muscle well enough. You know that if it's abducting, it has to go to the lateral surface in order to have that mechanical leverage to abduct. Same thing with flexion. We don't need to say that it's inserting on the plantar surface of the middle phalanges of digits 2 through 5. As long as we know we're a flexor, we must be on that plantar surface. Oh, one more thing. For abductor digiti minimi, its innervation is what you'd expect for most muscles in the foot, which is lateral plantar nerve. And this is superficial foot, layer 1. And we'll go ahead and pause there and take a little break. Okay. So the plantar aponeurosis is a huge connective tissue structure that's actually a continuation of something else. The Achilles tendon, which is coming from the posterior compartment of the leg. We have the 3 muscles converging into a common tendon, which are gastrocnemius, soleus, and maybe plantaris if the person has that muscle. But that's continuing down as this tendon that's coming from the back and working its way forward. And then the continuation of it, is this plantar aponeurosis, which technically starts at the calcaneus, but it is a continuation of the Achilles tendon. But that's why I'm doing that color change. And this is kind of overlying flexor digitorum brevis, all the way kind of up to those toes. It's very superficial to flexor digitorum brevis. They look very similar, except the plantar aponeurosis does also extend out to the hallucis. And it's really just a thickening of all the fascia. So of course we have fascia all over the foot, but this is a true thickened portion of the fascia. And since it is a continuation of our Achilles tendon that way, you have this kind of cause and effect situation that can cause pain in your foot by having tightness in your calf muscles. So if you have really tight calf muscles, your plantar flexors, which is what I'm talking about, like gastrocnemius or soleus, that's really tight, you're gonna have a really taut Achilles tendon. And if that's continuing down into the fascia of your foot, you're then gonna have some pain on the bottom of your foot. Now to take that even further, imagine someone has fallen arches. We all have arches in our feet that are supported by ligaments and tendons of like posterior tibialis and anterior tibialis and fibularis longus. We need to support that arch of our foot because if our arch starts to flatten, we call that flat feet, you are putting tension on this plantar aponeurosis. And everything in the body is connected through a fascial chain. So if you start with tightness on the bottom, our most weight-bearing aspect of our body, and you're pushing down on that plantar aponeurosis and pulling it tight, you're then going to create tight calves, tight hamstrings, tight erector spinae, which are the muscles in your back, and then all the way up into your neck where you've got fascia going to your head. So you can even cause tension headaches by something like a flat foot. This plantar aponeurosis, you're going to hear about it so much. So I just wanted to talk about it a little bit. It's really important, especially with plantar fasciitis. So we'll just label that plantar aponeurosis. All right. So moving a little bit more superficially, we've got the second layer of the foot muscles. And the second layer only has two muscles here. And they're kind of very much in relationship with a prominent tendon that we have coming around the medial aspect of the ankle through the tarsal tunnel, which is that tunnel formed by the flexor retinaculum. So we've got all of our flexor tendons coming from the posterior leg going through this tarsal tunnel. And this tarsal tunnel is kind of, my goodness. It's kind of around here is where we're going to be having that flexor retinaculum really hold everything down. And we're going to have some really important tendons coming through here. One of which I'm going to draw because it's very important for the intermediate layer of this foot. So flexor digitorum longus comes around and sends its long tendinous attachments down the foot. I'm going to have to back up and make this bigger. So it comes down and it sends all the way to the distal phalanges of the second through the fifth digit. It's really only a tendon at this point. So we're not seeing any red on flexor digitorum longus. It is simply a tendon. The red ended back in the posterior leg before we got to the tarsal tunnel. Maybe there was a little bit there, but on the foot, mostly tendon. But what we have going on here is a muscle that's going to insert, hopefully you didn't hear that email notification, that was loud. I'm gonna turn on Do Not Disturb. So we have a muscle that's going to insert into this tendon, and then we have a bunch of weird muscles that are going to originate on this tendon. So let's draw the one that inserts on the tendon. This one is the square of the foot, and it's going to originate on the calcaneus, right over here too, and it's going to make a little square, kind of. Maybe you see a square there, maybe you see a trapezoid, it's all right, but that is the square of the foot. We're gonna call it quad for a quadrangle. I don't remember what that word is from geometry, but it's a four-sided quadrilateral, yes, quadratus plantae. So maybe it's not really a square, it's a quadrilateral, which doesn't necessarily mean it's a square. And I totally see a quadrilateral in this guy, and that is quadratus plantae. Its origination is the calcaneus. Very important origination for a lot of muscles, as we're seeing. But its insertion is flexor digitorum longus tendon. How interesting. So that is why its action is to help flexor digitorum longus flex the toes. So it is the accessory flexor of digits 2 through 5. And its innervation, like most other muscles in the foot, is lateral plantar nerve. Now we have another muscle that's going to originate on this tendon and then go out to the toes, specifically the phalanges. And these are the lumbrical muscles. So they're going to start here on the tendons. Let me get a different color. They're going to start here on the tendons of flexor digitorum longus. And they're going to move up and actually out of view from where we are now, because they're going to go over toward the phalanges to this place known as the extensor hood of digits 2 through 5. So I'm kind of trying to draw them go out of sight here. Remember our little dashed look? That's kind of showing it's on the other side of the bone. So we're going to the dorsum of the foot with these muscles. How interesting. And I believe there's one more, yes. So these are the lumbricals. And their origination is flexor digitorum longus tendon, and its insertion is the extensor hoods of the 2nd through the 5th digit. Now, you kind of have to wrap your head around how this muscle is actually working in the foot. It's a little bit easier to visualize in the hand. So how this works is you've got a muscle on the plantar surface of the foot. So we'll say this is the foot, right? And this is its plantar surface, dorsal surface. So on the bottom of the foot, we've got these lumbricals that are starting on that flexor digitorum tendon and then going toward the phalanges and then going to the dorsum of the foot up here. So we're starting down here and then coming up here to attach on the extensor hood, which is running right on top on that dorsum of these phalanges. So what's going to happen here, since we're crossing the joint below right here, if we pull, it's going to shorten the muscle like this. So we're going to flex at the metatarsal phalangeal joint, which is the joint we're crossing here. Notice that from here, this is the location that we're coming from in surface on the bottom of the foot to on the other surface. That's why we have those dashed muscle belly lines. We're changing from the back or the plantar surface to the dorsal surface. So this is where we're going to be able to flex. But then when it comes to, and let me actually draw this, it comes a little bit more up here because the extensor hood's a little bit more distal. But notice when we come to the PIP joints, we are well on the dorsum of the phalanges. Hopefully we can all agree on that. So what's going to happen if you're on the dorsum of the phalanges, you're going to extend them. If you're on the back, you're going to flex whatever joint you're at. So we're on the back at the MTP. This is where we're on the plantar surface. But when we come to the PIP, we are now on the dorsum of the foot. Two very different orientations these lumbricals take on their journey to the extensor hoods. So at the MTP, if we're on the plantar surface, we're going to flex just like all of the other flexors. So we're going to flex the MTP. However, we're on the dorsum of the phalanges by the time we get to the extensor hoods. So crossing this area here, we're on the other side. So we're not going to flex. We're going to extend the pips. So two very different actions, but it makes sense when you think about, oh, it's starting on the plantar surface and then coming on the other side. So that's how it's able to have two completely different actions. Now, if that's like, I don't want to remember all of that, I understand. You can kind of just remember that these are the puppet muscles. So when you're doing a puppet, you have to flex your metatarsal. This is your proximal phalange. You have to flex that joint, metatarsal phalangeal joint. We're flexing here, but we're not going to flex the pips and dips, or I should just say the pips. We're not going to flex the pips. We're going to keep those extended. This is extension. This is flexion. So we're going to flex at the MTP, but keep extended at PIP and even dip too. We're not really worried about dip though, but PIP is going to be extended. So we've got flexion at MTP, extension at PIP, and this is the puppet muscle. Puppets are weird. Lumbricals are weird. They look like worms. I think it means, lumbricals mean worm in Latin. Worms are weird. Puppets are weird. It crosses the joint, which is really weird. So lumbricals are just pretty weird in general. So kind of group all of those things together. Now, one last thing, innervation. And since we've got 4 of them, we're going to have to differentiate. This is the lumbrical of the 5th digit. This is the lumbrical of the 4th digit. This is the lumbrical of the 3rd digit. And this is the lumbrical of the 2nd digit. The lumbricals of the 3rd through 5th, lateral plantar nerve. However, the 2nd is the medial plantar nerve. Another weird thing about the lumbricals, right? Like you have dual innervation. How weird can you get? But so just group all these exceptions and weird qualities to the lumbricals and you'll be good on the exam, I think. So that is layer 2. All right, so now we're back at the foot, and now we're going to go a little bit deeper from that second layer, and now we're going to look at the third layer, which has 3 important muscles. The first 2 are going to kind of allude back to what I was saying about the superficial surface and how we've got muscles that work on hallucis and muscles that work on digiti minimi, and they're very much symmetrical. If you've got one that's going to do that to hallucis, you've got one that's probably going to do that to digiti minimi. So let's take a look at those. We have flexor hallucis brevis, which is the short flexor of the big toe. That one's going to originate on the cuboid and the lateral cuneiform, and then insert on the base of the proximal phalanx of the first digit. So let's draw that. So this is hallucis, the big toe here, and we're going to find its origination by following that kind of order. We know that the first metatarsal is going to articulate with the medial cuneiform, the second with the middle cuneiform, and the third with the lateral cuneiform. So we know this is lateral cuneiform. And we need cuboid. Cuboid is over here articulating with the 4th and the 5th metatarsal. So hopefully that's helpful kind of orienting. I know at first these bones are just like, I don't know which is which. You're telling me that's navicular, I'll just believe you. But just think about that relationship. What articulates with the 1st, 2nd, 3rd, 4th, and 5th? And then what forms the base of the cuneiforms? That's navicular. But let's just go ahead and draw that insertion point of flexor hallucis brevis. So mostly kind of cuboid. I'm wondering if my notes are wrong here, because that just kind of seems like it shouldn't be at cuboid. Let me pause the recording really quick. So as we were saying, abductor hallucis or flexor hallucis brevis is starting here at cuboid in the lateral cuneiform. And it's going to kind of come over here to the base of the proximal phalange. This is the base area. And this is going to be a major flexor of our big toe, along with flexor hallucis longus. And we also have a little bit of a tendinous insertion with this muscle. This is also kind of inserting over here where we had flexor digitorum longus tendon. Remember that from the previous drawing. This muscle is also kind of coming over here and kind of has 2 heads of origination. You'll see that in a lot of images, but we're not going to put that here for now. We'll just kind of show this dual kind of origination, but its insertion is going to be at the base of the proximal phalange. And this is flexor hallucis brevis. We know it's a brevis because it's got muscle belly in the foot. And all brevises start in the foot and end in the foot. So they're all muscle belly in this region. Flexor hallucis longus, however, is not that way. And actually, this is going to kind of make a snake tongue like this. So that flexor hallucis longus can come through here, through that tarsal tunnel, right over this. And it's going to go through the snake's tongue and go to the distal phalange. This is flexor hallucis longus. So we've got flexor hallucis brevis and its counterpart, flexor hallucis longus, coming from the posterior compartment of the leg. And together, they are going to flex hallucis. So we're just putting FHL there in reference so we can see how this kind of happens. And in the lab, if you have a chance, ask Dr. Love, or I'm pretty sure you're able to just go ahead and do it. Try to increase your dissection a little bit more up into the ends of the toes so you can see how flexor and extensor tendons are forming this snake-tongue relationship. It's really one of the most interesting things I remember from lab. So that's flexor hallucis brevis. Let's take a look at the symmetrical image for digiti minimi, because again, we have that kind of symmetrical relationship going on. So we've got a flexor of digiti minimi. Its name is telling you, I flex the mini digit, or the fifth phalange. It's going to originate on the base of the fifth metatarsal and then insert on the base of the proximal phalanx, of course, of that digiti minimi, the fifth digit. So base, this is the the fifth metatarsal. Gonna come up. We're gonna go right here to the proximal phalange. And this one is the flexor of the small digit. Really nice little muscle there. Tells you everything it does, but maybe it's a little confusing. Why are we calling it a brevis? Well, I guess you can say that its longest is flexor digitorum longus, because FDL does go to the fifth digit as well to help flex it. But I know that's a little confusing at first. It's like, where is the longest? I don't see flexor digiti minimi longus. And its origination is the base of fifth metatarsal. Insertion is the base of proximal phalanx of the fifth digit. And its action is, of course, to flex digiti minimi. Tells you in its name. And its innervation is the lateral plantar nerve. Just like most muscles in the bottom of the foot are innervated by that lateral plantar nerve. Flexor hallucis brevis, however, we now have found the fourth and final muscle that is innervated by that medial plantar nerve. So we'll say innervation, medial plantar nerve. Its origination, we saw, was cuboid and the lateral cuneiform, and a little bit of that FH, actually flexor digitorum longus tendon, not flexor hallucis longus tendon, which you'd expect. But we're not going to worry about that. That's too much information and it's not really important right now. Insertion, however, is the base of the proximal phalanx of the first toe. And it's going to make that snake tongue so that we have a place for flexor digitorum longus to continue its distance all the way to the distal phalange. And we have one more muscle in this layer, which may be a little weird to wrap your head around. I remember it as the 7 of your foot, because it makes this really cool 7 going toward the big toe. So let's get a new color here. This muscle is called adductor hallucis. So it's going to adduct or bring that big toe toward the embryological midline. And it's going to start with its origination. It actually has 2 heads. So we'll start with its insertion and then go from there. Its insertion is the base of the proximal phalanx of the first digit. And it's kind of the medial surface of it, because we're going to adduct, right? So we've got to be kind of medial, whereas the abductor is lateral on this same bone. It makes sense when you think about what direction we need to move this spot. Like I said, insertion is the base of the proximal phalanx of the first digit. And then it's got a transverse head, which is going to go transversely across all of the heads of the metatarsal phalangeal joints. So I should say not the heads of the metatarsals, they're literally connecting to the metatarsal phalangeal joints themselves, which are near the heads of the metatarsals. So here's one head going across. And if you tried to find this in your dissection yesterday, you weren't able to find it because there's just probably so much there that's covering it. But there is this head that's kind of tucked away that's helping us adduct the big toe. And this is the transverse head. We have an oblique head, which is actually going to originate on the base of the metatarsals of the second through the fifth digits, which is here, here, and here. Second, third, fourth, and also the fifth. So also down here a little bit. And then we're going to just go up and make a 7. Do you see the 7?
Yes. Mhm.
Yeah,
You're
right.
not alone. We're still here. We're all just really intently listening.
Yeah, I totally know. But thank you for saying that. But yeah, that's that 7 right there. Really prominent little 7. And we can see that if we shorten these fibers, so kind of bring them this way, the arrows may not be helpful. But if we shorten that oblique head of adductor hallucis, we're going to pull the big toe this way. And if we shorten the transverse head, we're going to pull the big toe this way. And that's all fine and dandy. Both ways are bringing us toward that embryological midline. Because, yeah, which is this second toe, just so you're wondering. It's not the midline of the person's body. We're talking the midline of the foot. And this is, let's draw a little more info. This is adductor hallucis. In adductor hallucis, we know its origination is different for both heads. So we're going to have 2 categories. This is transverse. This is oblique. The transverse head is going to originate on the metatarsal phalangeal joints of the second through the fifth joints. The oblique head is going to originate on the base of the second through the fifth metatarsals. So that's the actual bone itself. This is the base or the body of the metatarsal. So we're going to start there, and then we're both going to insert on the proximal phalanx, the base. We'll just say first proximal phalange, the base. A lot of different descriptive terms you have to throw around when you're talking about these phalanges, but hopefully that makes sense. It's the first toe, it's proximal phalanx, and the base of it. And if we want to be even more descriptive, we can say the medial surface of the base of the first digits, proximal phalanx. Better to be descriptive than unclear. And we can see it's really going to that medial surface right there, so we can pull it toward that embryological midline. And its innervation, you'd think, well, it's moving the big toe, it must be the medial plantar nerve. No, there's only 4 muscles that are innervated by the medial plantar nerve, and this is not one of them. This is the lateral plantar nerve. So mostly lateral plantar nerve in this layer, except of course the flexor of the big toe, which is really oriented on this medial surface of the foot. So of course the medial plantar nerve is going to take it. It's running right through there. And I'll show you guys the nerves and the blood vessels that are going to run through here once we're all done, and we can really see how they're going to be going through the muscles and what relationship they make with one another. But this is the third layer. We'll finish now with the fourth layer. So we're now on our final layer, layer 4. So we're now on the deepest layer of muscles that we're going to be able to find on this plantar surface of the foot. And these muscles are our dabs and our pads. So you've got your dorsal interossei, which are actually on the other side of the foot, but we can still draw them. And then we have our plantar interossei. And these are the adductors and abductors of these digits. We know we had an adductor for the big toe, the 7. We had an abductor for the big toe in the superficial layer, but we don't really have anything to adduct or abduct these digits, except of course this one, but we still need to adduct them. So how are we going to do that? Well, we need the pads and we need the dabs. The dabs, D for dorsal, pad, P for plantar, and dab, D-A-B, they're going to abduct. So dabs are responsible for abducting all of our digits, or I should say our 2nd through 5th digits. And that's going to occur at the metatarsal phalangeal joint. So let's kind of show this. So we've got our dorsal interossei and our plantar interossei. I'm going to start by drawing our plantar, since that's the surface of the foot that we're looking at right now. Now the plantar, they're going to all originate on the medial sides of the metatarsals. And we're only going to have them for digits 3 through 5. So let's get our color. This is good. We're going to start on the medial surface. This is the 5th. Medial surface of the 4th. Medial surface of the 3rd. And then the medial surface of the 2nd. And what these are going to be doing is they're going to insert on the extensor hoods and the bases of the proximal phalanges of digits 3 through 5. So we're going to come up to the extensor hood over there, and then also kind of to, oh, it's this way, sorry. My guide image is actually flipped, so that completely like threw me off. We're kind of going this way. We're also going up to that extensor hood as well. And these are on the plantar surface. So we're going to call these plantar interossei. Oh, I'm sorry. There actually should not be one here. So I'm going to grab my little eraser. Just kind of erase this one here. We're only able to do this at digits 3 through 5. So do be aware, there is kind of a little trap you can fall into, because there is an exception for these plantar and dorsal interossei muscles. The dorsal interossei are going to be inserting on digits 2 through 5. The plantar interossei only 3 through 5. Let's write that out here. Origination of the plantar interossei, medial sides of metatarsals 3 through 5. So here's 3, 4, and 5 metatarsal. We're on that medial side because the big toe is medial. And we're going to insert onto the extensor hoods and the bases of the proximal phalanges of 3 through 5. And I underline that 3 so you don't make the same mistake that I just did. Now, dorsal interossei. These are going to be on the other side of the foot. But let's just go ahead and just kind of show where they are here. So these are going to be originating on the sides of adjacent metatarsals. So they're kind of in between. Let me just go ahead and show a different foot surface. I know this is kind of breaking up the drawing, but I think it's going to be worth it for our purposes. So I'll move this down so we can see the other ones, the dorsal interossei. So these are originating on sides of adjacent metatarsals and then inserting into extensor hoods and the bases of the proximal phalanges. So we're just kind of in between, that's 2, color it in there. So in between, we're on the dorsum of the foot. We're in between on the dorsal surface of the foot. And then from here, we're going to insert on the extensor hoods and the bases of the proximal phalanges of the 2nd, the 5th digits. And since we're on the dorsal surface, these are our dabs. So these are going to abduct. Why does it look like this? Oh. Dorsal interossei. So these are originating on adjacent metatarsals sides. So just right in between. This one is adjacent to this one. It's right in between them both. And its insertion is going to be the extensor hoods and bases of proximal phalanges of 2 through 5. Now, we said this is the dorsal, so it's dab. So this is our dab, which are going to abduct digits 2 through 5. And while we're here, we're on the dorsum of the foot. We're going to go ahead and just draw in the muscles that are in this area. There's only 2 of them, so that's kind of nice. We've got 2 muscles that are kind of on the top of your foot. If you have your foot near you, which you should, you can go ahead and feel the dorsum of your foot, and you're going to feel a kind of pad toward the ankle that actually has a lot of muscles in it. And you can start to extend your toes up and back and feel that pad become very tense and contracted. These are your extensors of your digits and the extensors of your big toe, the brevis. So we've got extensor hallucis brevis and extensor digitorum brevis. We'll start with hallucis. Hallucis is going to originate on the superior surface of the calcaneus, which is right here. Because this is calcaneus. It's a huge bone, we remember, from the underside, and it kind of wraps around and articulates with cuboid. So we've got cuboid here, And then calcaneus, where I have the yellow drawing showing that origination of extensor hallucis brevis. It's going to insert on the base of the proximal phalanx of the hallux. So we're going to go through here to that proximal phalange right there, the base. Base, body, whatever you like to call it. Seems Grays likes to call it the base. And this is extensor hallucis brevis. Extensor hallucis brevis is going to originate on the calcaneus superior surface. And it's going to insert on the base of the hallucis, or base of the proximal phalange of hallucis. And of course, it's going to extend hallucis. It's in its name, tells you what it does. And then one last muscle here is the extender of the other digits. And it's very similar. It's going to originate on the superior surface of the calcaneus, right about here, on the same side as our toes. And then it's going to go out to the same place, just on the 2nd through the 5th digits. And this is extensor. Let me draw my little arrow. Extensor digitorum brevis. Origination, superior calcaneus. Insertion, base of proximal phalange of digits 2 through 5. And it's going to extend those digits. Technically, the dorsal interossei are in the 4th layer. I don't know why. That's how it's grouped. But these two are extensor hallucis brevis and extensor digitorum brevis. Those are muscles in the dorsum, the dorsal aspect of the foot, and that's where they're officially grouped. Dorsal interossei and plantar interossei are kind of together. And this is the pad. So it's going to adduct. And that's why we don't need one for the second toe. The second toe cannot adduct. It's the midline. The second toe is the midline we're looking at when we're talking about abduction and adduction in the foot, so that we can't really adduct our midline. So you're already in the midline. So hopefully that makes sense why we only have it going to the 3rd through the 5th digits. I'll go ahead and pause the recording. So the blood vessels in this area, they're all going to be coming from a very prominent blood vessel that came from the posterior compartment of the leg. It's coming around the medial surface of the ankle. It's called the posterior tibial artery. And it's in that tarsal tunnel along with flexor digitorum longus, flexor hallucis longus, posterior tibialis, as well as the tibial nerve are all running through this tarsal tunnel. And right after it kind of finishes its course through the tarsal tunnel, it's going to split off into its 2 terminal bifurcations. The first of which is going to head medially, go toward the big toe, send out some branches here, and a few to the 2nd and the 3rd digit. But we don't really need to be too aware of its terminal branches of this medial plantar artery. It doesn't really terminate into anything that we're going to be paying attention to. However, the other termination of the posterior tibial is going to run laterally. It's going to work its way through here. Let me pull up my reference image so I'm really drawing this as accurate as possible. Once it gets around the bases of the metatarsals, it then changes course. And this is just great to look at with the magenta behind it. Let me hopefully lighten this up a little bit so you can, no, that doesn't really help. At least it's enough contrast for our purposes. But when it takes this bend, it is called something else. So we're going to circle this aspect and call it the deep plantar arch artery. We said that this one here is the lateral plantar artery. And then this one here is the medial plantar artery. And then this is still already labeled medial plantar artery. That's fine. The more the merrier. This is the deep plantar arch, which is a termination of this lateral plantar artery. And what happens from the deep plantar arch is that we're going to give off some plantar metatarsal arteries that are going to supply blood to these digits. And I don't believe for class you actually need to know those blood vessels. I think the deep plantar arch is where she stops. Just in case I'm wrong, I'm just going to go the distance and just tell you what these are. If it's not in your lecture, just forget about it. These are the plantar metatarsals. And those all came from the deep plantar arch, which this is the deep plantar arch. This is the deep plantar arch. So the deep plantar arch continues along this kind of transverse direction and then gives off branches as it goes through its course, which are the plantar metatarsal arteries. And then the source of all of this blood in the plantar surface of our foot is our posterior tibial artery. So those are our arteries. Now the nerves, it's really nice. It all kind of follows the same structure. Except this time, we've got the tibial nerve. Didn't mean to change colors there. The tibial nerve is also a structure that's in the tarsal tunnel, running through there with all the flexor tendons, posterior tibialis, posterior tibial artery, and like I said, the tibial nerve is also here. And right around that medial malleolus, once it finishes, along with the posterior tibial artery, they're going to bifurcate. They're going to give off two terminal branches and form this Y. One prong of the Y is going laterally. So we're going to call it the lateral plantar nerve. And then from here, it just kind of sends off a lot of branches. And then the medial plantar nerve is going to come here and send off a lot of branches. Now, let's label these. This is the medial plantar nerve. This one is the lateral plantar nerve. And they were both sourced from the tibial nerve. So here's the tibial, oh, not that, this. That's the tibial nerve, along with the posterior tibial artery, which run through the tarsal tunnel, always on that medial surface of your ankle. So now if you cross your leg, if you find your medial malleolus, palpate it, and then go behind it and push deep enough to where you feel your pulse. It's kind of right near that medial malleolus. How prominent of a pulse is that? That's your posterior tibial artery. Very palpable. You're going to be seeing it throughout your journey as a clinician. So that's where it is. Take a look at the cadaver videos and really make sure you can visualize that structure running through that tarsal tunnel, because it's a really important landmark. All right. Now the medial plantar nerve, it's going to be sending, let's come down here where we have a little space. Medial plantar nerve is going to send muscle innervation to 4 muscles. Those 4 muscles are flexor, hallucis, brevis. We've got the second lumbrical. We've got, what else? We've got abductor, hallucis. And there's one more. I'm having a hard time thinking about it. Can anyone maybe shout out? Well, flexor digitorum brevis. Kind of the last one you'd expect to be, innervated. There we go. It went away. To be innervated by the medial plantar nerve, because it's going to the digits, which are lateral. But it just so happens the medial plantar nerve is running right in the area where we have flexor digitorum brevis, which is not on this image, but it just so happens to be a good spot for it to innervate. So it's going to do that. In terms of sensory innervation, the medial plantar nerve is going to be innervating the medial foot on the plantar surface. So cutaneous innervation to medial plantar region. And it specifically is going to go all the way. It's going to take the first, second, third, and then half of the 4th digit. So first through, I guess, 3.5 digits. It's going to take half of 4. The lateral plantar nerve is going to innervate every other muscle. But it's sensory innervation. I'm going to remove tarsal tunnel. Yeah, that's not working for me. I'll just kind of write it over here. Cutaneous is the lateral plantar region, kind of obvious by the name, but specifically the 5th digit and half of 4. And then also lateral plantar surface. Sorry, that's really messy, but hopefully that was helpful in terms of organizing what these are bringing innervation to. The medial plantar nerve is only 4 muscles. So just remember what those 4 muscles are and you'll be good. The lateral plantar will take over the rest. Tibial nerve is what gave off all of those different nerves. And then of course our blood supply came from the posterior tibial artery when we're talking about the plantar surface. I didn't have time today to talk about the dorsal aspect of the foot and the dorsalis pedis, but that's a continuation of the deep fibular artery. No, it's, oh gosh, I should have looked at that one a little bit. Completely erase what I just said. I have to look at my notes. Give me 1 second. It is not that. There's no deep fibular artery. So it's a continuation of the anterior tibial, yes. The anterior tibial artery is going to continue down the anterior compartment, go to the dorsum of your foot, and become the dorsalis pedis artery. I'll just quickly draw that because I kind of butchered that by lying to you and saying the deep fibular artery. So now I'm going to have to fix that. So let's just show it here. If we were to kind of be a little more three-dimensional, we'll say this was coming up from the leg, right? This is that anterior tibial artery. And then once we get down to the top of our foot, we're going to continue down. And it's going to specifically kind of follow this direction through the first and the second digits. And then kind of send off an arcuate artery going to the other digits, but not really something we need to be thinking about for this class, but just kind of put arcuate. And the arcuate is going to send off blood to the digits. But this dorsalis pedis here, let's do that in black.
Sorry, Tyler, is this supposed to be on the dorsum of the foot or the plantar surface?
Yeah, we're on the dorsum. Oh my God. And thank you so much. I was going so fast, but yeah, we're going to pretend
Okay.
the dorsum of the foot. That's a good catch though, Anne. It's a really good catch. But yes, we would be flipping this foot over and seeing talus much more readily. But just kind of visualize the same kind of structure going on in the dorsum of the foot, where we have the anterior tibial artery coming down from the leg. We'll say this whole thing is the leg, and it comes down and it goes really in between your first and your second digit. So we're feeling it right around here very prominently. And it sends off some branches to the big toe and then separates into the second toe as well. But if you wanted to palpate this artery, you absolutely can. And you want to kind of go down your foot and you want to kind of extend your toes a little bit so you can feel the extensor hallucis longus tendon, which is here. And then extensor digitorum tendon, which is there, creating this frame for dorsalis pedis. So you can extend your toes, feel the tendons, go in between. And it's not the easiest to palpate, but if you're in the right region, you will feel a pulsation right in between those two tendons, right through there. And that is dorsalis pedis artery. Dorsalis pedis longus, they also call it. Dorsalis pedis is okay. All right, I'll go ahead and pause the recording. Actually, I can probably stop it.